The Nurses Bargaining Association, NBA, has opened negotiations with the Health Employers Association of BC, HEAP, to seek a contract that respects, recognizes, and addresses the dire working conditions of nurses in the province. The NBA represents more than 40,000 nurses who work in hospitals, clinics, community health centers, and other healthcare settings. They have been on the front lines of the COVID-19 pandemic, facing unprecedented challenges and risks to their health and safety. They have also been dealing with chronic understaffing, excessive workloads, violence and harassment, and lack of adequate equipment and resources. These issues have led to burnout, stress, fatigue, and low morale among nurses, affecting their ability to provide quality care to patients. The NBA is calling for a fair and reasonable contract that reflects the value and contribution of nurses to the healthcare system. They are asking for improved wages and benefits, enhanced staffing levels and recruitment strategies, stronger occupational health and safety measures, and more respect and support from the provincial government and the HEAP. The NBA hopes that the negotiations will result in a positive outcome that will benefit not only nurses, but also patients and the public who rely on their vital services. The nurses of British Columbia are facing unprecedented challenges and risks in their work. They are on the front lines of the pandemic, caring for patients and communities with compassion and professionalism. But they are also exhausted, overworked, and underpaid. They deserve better leadership and compliance from the provincial government. That's why the Nurses Bargaining Association, or NBA, is asking for key priorities such as improved staffing levels, nurse-to-patient ratios, work-life balance initiatives, safety improvements, and fair pay. These are not just demands, they are essential needs for the health and well-being of nurses and their patients. Let's take a closer look at each of these priorities. First, improved staffing levels. The NBA wants to ensure that there are enough nurses to provide safe and quality care in all settings and situations. This means hiring more nurses, retaining existing ones, and reducing turnover. It also means addressing the chronic understaffing and overtime that leads to burnout and fatigue. Second, nurse-to-patient ratios. The NBA wants to establish clear and enforceable standards for how many patients a nurse can care for at a time. This will prevent unsafe workloads that compromise patient safety and outcomes. It will also allow nurses to spend more time with each patient, providing holistic and individualized care. Third, work-life balance initiatives. The NBA wants to support nurses in achieving a healthy balance between their work and personal lives. This means providing flexible scheduling options, adequate breaks and rest periods, access to wellness programs and resources, and recognition for their hard work and dedication. Fourth, safety improvements. The NBA wants to protect nurses from physical and psychological hazards in their work environment. This means ensuring adequate supplies of personal protective equipment, or PPE, implementing infection prevention and control measures, preventing violence and harassment, and promoting a culture of safety and respect. Fifth, fair pay. The NBA wants to ensure that nurses are compensated fairly and equitably for their skills, education, and experience. This means negotiating competitive wages that reflect the value and complexity of nursing work, as well as providing benefits such as extended health care, pension, and professional development. These are the key priorities that the NBA is asking for in their bargaining with the provincial government. They are not unreasonable or unrealistic. They are necessary and urgent. The nurses of British Columbia deserve better leadership and compliance from the provincial government. They deserve respect, support, and recognition for their vital role in our health care system. One of the measures that the provincial government has taken to support nurses is to waive the fees for internationally educated nurses to apply and be assessed. This means that nurses who have completed their education and training outside of Canada can apply to work in B.C. without paying any fees. The government hopes that this will attract more nurses to the province and help address the shortage of healthcare workers. However, some nurses say that this is not enough to solve the problem. They argue that waiving the fees does not guarantee that internationally educated nurses will be able to find jobs in B.C. or that they will receive adequate orientation and mentorship. They also point out that there are other barriers that prevent internationally educated nurses from working in BC, such as language proficiency, credential recognition, and cultural differences. Therefore, they demand that the government provide more support and resources for internationally educated nurses to integrate into the health care system and ensure quality patient care.